During the COVID-19 pandemic, it's vital that hospitals and health systems are equipped with personal protective equipment, PPE, to ensure the safety of their healthcare workers while providing care for patients. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Senior Writer with AHA. In this podcast, A.J. Rolle, Senior Program Manager at the AHA, moderates a discussion between Marc Berejka, Director of Government and Community Affairs at REI, and Bill Burke, CEO of Merit Solutions, on how their organizations are contributing to AHA's 100 Million Mask Challenge through HealthEquip, a smart app that connects individuals and organizations who have PPE to hospitals treating patients with the coronavirus.
Thank you, Tom. So in response to the COVID-19 pandemic that has upended the supply and demand of personal protective equipment, or PPE, the American Hospital Association, Microsoft, Kaiser Permanente, Kearney, UPS, and Merit Solutions launched a smart application called HealthEquip. This app is one avenue created to deliver PPE to healthcare providers through the AHA's 100 Million Mask Initiative to streamline the donation and receiving process of PPE. Also, organizations such as REI have provided monetary donations to support these initiatives, as well as sharing this important work across their network. So Bill, let's start with you. Can you tell us more about the HealthEquip app and how donors, suppliers, and hospitals can use HealthEquip?
Sure. Thank you, AJ. The HealthEquip app came into existence firstly to solve the ethical distribution problem for PPE during this pandemic, meaning to get donated PPE or funds that turn into donated PPE into the lines of frontline healthcare workers that need it most, not necessarily to those hospitals that have the most influence or affluence, but based on needs criteria. So HealthEquip does two things uniquely. First, it uses, it's a app that hospitals and healthcare workers can enter in needs requests, but it uses ethical matching then based on the needs criteria that they also share: number of doctors and nurses treating COVID-19 patients, number of COVID-19 patients, quantity on hand of critical supplies, and it uses an algorithm to match the donated PPE to the needs requests and then makes the decision on what PPE should be shipped to each of the hospitals and healthcare workers that are requesting those donations. And so in that manner, it's going to be based on needs. It's an ethical approach to solving a supply constraint. The second is it handles all of the point-to-point shipping, and it does all that at no cost to the donor. So the app, not unlike when you return something to Amazon, and you select, you go on your phone, you select what you're returning, and you receive a label. HealthEquip does the same thing. It sends the label to the donor, and it's just as easy as putting that label on the donated material, and HealthEquip takes care of the rest. It handles the shipping with our partner UPS, it tracks it, and then makes sure the hospital receives the PPE.
Great, Bill. Sounds like HealthEquip is a great platform, especially how you described the ethical algorithm to match hospitals that need PPE with either individuals or organizations that are donating PPE to ensure that hospitals that need PPE the most are receiving this equipment. And recently, I believe HealthEquip also launched a marketplace where hospitals can interact directly with suppliers. Can you describe more of that piece that hospitals can also use to get PPE?
Yeah, for sure. The other sort of dynamic that happened during the pandemic is that we somewhat forecasted that the first 4 to 6 weeks of launch, and this we started in May, that there would be a lot of donor supply that we could capture. And so we were very fortunate to join forces with AHA's 100 million mask initiative and be able to amplify the platform and connect it to needs, but also connect it to donated supply of PPE. And these are woodworkers that had N95 masks. In many cases, these were dental offices that had gowns and masks and were willing to donate those, even though they knew they would need that same PPE later when they reopened. But we were very successful in gaining supply, and we've actually enabled shipping now of over 300,000 PPE items to donor recipients. But we knew that supply would run out, and so we, in parallel, built a way for procurement to happen, particularly procurement with new suppliers of PPE. Some of those are US-based companies. These are organizations that maybe previously made teddy bears or upholstery for airplane seating, and they converted to making masks, gowns, face shields. And so we wanted to provide, first of all, provide a path for those suppliers to be found, and additionally, open up another avenue of supply for healthcare organizations that had a need that wasn't being met. So we added the HealthEquip marketplace to the platform, and that has been very valuable in even our current model that we see for donations, which is really more of a funding. Maybe the organization doesn't have masks to donate, but they can donate funds. And so we'll take intake of funds through our 501c3. We will convert that into exact procurement using the platform, and then match it to exact needs endpoints that we have through the donor part of the platform. And so today we're seeing that was a prescient decision. And we have, my goodness, 40 different providers in that procurement platform that have masks. And then we added the component, which is named Verified by HealthEquip, because the biggest challenge now, and certainly it has been a tremendous challenge, is counterfeit product entering the healthcare supply chain. So we have a program named Verified by HealthEquip that allows us to take the actual item level information, verify that the item is not counterfeit, go to the CDC and FDA source databases and match to that. Also do background checks in combination with the AHA and GHX. We have a process of doing background checks on the providers to make sure that they themselves are not fraudulent companies. And so that we've been able to move pretty fast up the maturity curve to not only handle donations, but also to handle procurement, and most importantly, ensure that that product that is going to the healthcare worker is efficacious. It is, in fact, a valid tested item, and that any claims as to FDA certification or CDC certification are actually true. So that's sort of how we've expanded the platform over the past couple of months, including the marketplace.
Thank you, Bill. And yeah, it does sound like HealthEquip has evolved into a pretty robust platform where hospitals can either go to the donor exchange to be matched with those that are donating PPE, or the marketplace where they can directly purchase PPE from sellers that you've verified both the company and also the products. So Marc, I want to turn it over to you, and we know that REI has been a valuable partner in supporting both the 100 Million Mask Challenge and also HealthEquip app. Can you tell us why your organization became involved in these two initiatives?
Yeah, happy to, AJ, and I just want to heap a bunch of praise on the partnership that undergirds HealthEquip, and in particular the work by Bill and his team at Merit Solutions, who've just demonstrated that tenacity, that creativity that has helped immensely in closing the PPE gap in different parts of the country. I'm a lucky guy who gets to oversee the philanthropic work of REI Co-op. And if I go back in time, it was early to mid-March when the Co-op, as a 160 store plus retailer, was grappling with the fact that government shutdowns were coming, closure orders, et cetera. We ourselves were very concerned about the health and well-being of our employees. Moving into the second half of March, we were rapidly shutting up shop, if you will, at least in the physical environment as opposed to online. But the leadership of the co-op, we're very community-oriented organization. The leadership of the co-op said, we can't forget about our communities. So even if revenue was dropping off a cliff, we wanted to find some way to be helpful to the larger effort to close the national PPE gap. And I had caught wind of the 100 million mask challenge. I did a little bit of reverse engineering. I talked to local participants in the 100 million mask challenge, several of whom, as Bill described, were repurposing their existing manufacturing facilities, moving from airplane seat manufacturing to PPE manufacturing, or from ski masks and ski goggles and ski jackets to PPE. And I distinctly remember standing on my patio on a Saturday morning talking to one of these guys who had converted his manufacturing and it was starting to crank out masks, to ask him what he thought. And it turns out he was an REI co-op member also. And he said, Mark, if if you're going to take the feedback from a co-op member, maybe the best use of your dollars isn't to necessarily spend, say, 100,000 buying 100,000 masks, because masks are going quickly. They're being used up very quickly. It would seem as a co-op, you'd want to do something that has a little bit more scale, a little bit more leverage. And I really took that counsel to heart. It resonates with how we feel about our own philanthropy. We look for maximum leverage. And as a result, I poked further into the 100 million mask challenge, and I was connected to the Kearney consulting firm and through them to Bill. And I thought, this is it. This is what maps to our goals as a philanthropist, as a donating business, to support a platform that's looking to match PPE donors with those in most need of PPE. And then eventually even, these newfangled PPE producers who could take advantage of the marketplace. It might be a bit of a stretch, but in some respects, REI Co-op is a platform. We assemble what we think is some of the best outdoor gear and apparel that's available in the United States and beyond. And then we make it available to our co-op members at a reasonable price, high quality goods at a reasonable price. Bill and team have stood up HealthEquip, which fulfills that role for PPE and also enables donors to support the movement of PPE to those in most need. So it took a little bit of investigation, but by the time we came upon Bill and HealthEquip, we couldn't be more delighted with how it's turned out.
Great, thanks, Mark. And that's great to hear that, as you're doing more of the research and the outreach, that the work that AHA has been doing with the 100 million mask challenge and work that Bill's team has been leading with the HealthEquip app really did align with REI's mission and vision and strategy, and that you were able to provide ongoing support and donations to both of these initiatives.
So, yeah. I couldn't agree more. I would not have been able to find a way to plug REI into the larger nationwide PPE challenge, but for the fact that AHA had taken on this 100 million mask challenge. That inspired me. And then I think my first communications with AHA in the early to mid-April timeframe, and within a week or two after that, AHA had steered me to this one project of theirs, HealthEquip.
Thanks, Mark. And so Bill, how did REI's contribution help support HealthEquip in reaching more hospitals in need?
Yeah, tremendously. So as Mark shared, the
point of view that REI had and Marc had of looking for a one-to-many way to make impact matched up perfectly to the timing of our program, which, by the way, is a pro bono program. So the platform was built with pro bono charitable investment by Merit Solutions, which is a 60-person company it's a cloud apps company for hospital supply chain, and it was built with pro bono investment from Microsoft. It was a tremendous partner in bringing engineering resources forward. And so, and it was true for every other member of the coalition for Kearney, AHA, and Kaiser Permanente. And so we built this platform. It was highly successful in meeting initial need, but then we sat around and said, well, how are we going to operate this? How are we going to continue to month by month fund the support people that are necessary in it, and to improve it and to continue to meet the need? Because it became clear that by around July, August, that this isn't going to be a 4-month problem. This is going to be an 18-month challenge, right? And so the timing couldn't not have been better, because REI brought funding to the operating needs of the platform, funding technical costs. It also enabled us to hire 5 college interns. And if you have a college student in your family, you know that most internships have disappeared. And so we were able to turn around and give opportunities to 5 extremely talented college interns, one of whom is monitoring on this call today with us, to help us perform outreach to hospitals to refresh their needs, to help us with onboarding of suppliers as they went through that process of vetting with AHA and GHX, but then to do the actual verified by HealthEquip steps of looking at their items and verifying that they're not counterfeit. Those additional arms and legs were really important for us to be able to increase the trust and make sure that donated product coming through was not counterfeit. And it gave us the ability to have the sort of the confidence to lean forward and continue the operation of the program. And thank goodness that we did, because we shipped, my goodness, over 100,000 of those items shipped during the time that REI stepped in to help with funding. And as we go into this period of, I think, very difficult time during the winter for healthcare providers, not just hospitals, but all segments, that it's going to be important that we're there. And so REI has been a tremendous partner, but I really give Marc credit for seeing that way of being a funding partner, not just as others have, and we appreciate those others, not just giving funds to turn it into procured PPE right away and get it to hospitals, but to help us with the ongoing needs of operating the platform itself. And so it's been a tremendous relationship for us, and we very much appreciate REI's support.
Great, thanks, Bill. And we at the AHA too echo that generous support and ongoing support from REI. And I mean, that is one bright side, given, this pandemic, is all of these new partnerships and collaborations that have formed to address a common issue. And so, Marc, what are some of your key takeaways from this collaboration?
I think it does help to have this collaborative mindset. I mean, maybe that's oversimplifying too much, but I'll even go back to something Bill said a few minutes ago about the challenge of matchmaking in the PPE realm if you are only thinking in a point-to-point way. I've got my point solution and I'm looking for a way to deliver that solution to multiple other points. That's doable. I mean, that's the marketplace at work. But when you have folks who stand up and say, what we could really benefit from is this clearinghouse capability or this, common meeting place and let's go build that together and sustain it together, I think you make special things happen. And so, that's sort of my takeaway. I don't hope to find another national challenge, global challenge like this, in years to come. Maybe there will be, but I do think that in the heat of the moment, in particular, to think in this collaborative platform manner is super helpful. And I remain grateful to be able to work for a co-op that sort of comes to problems with that type of collaborative spirit.
Bill, what are some of the key takeaways from your end?
Yeah, I mean, I would share something very specific and then something broader. The very specific takeaway is the story of helping a hospital in West Texas right now that is rural West Texas, that is surrounded by hotspot infection rates, and that has something like 6 critical care beds, and is in that moment of need that would otherwise, if not for this national system that is considering their needs relative to their resources, would otherwise maybe not have been able to protect their healthcare workers. It's just in a very real way. I believe that this collaborative effort, this coalition, has saved a lot of lives, but not in ways that you otherwise might have been directly seen, right? And so we're continuing to see that as the infection, capacity gets constrained, protective equipment gets constrained, it moves around. But because there's this national open platform that is, free to participate in, and people, the hospitals with needs can get on digitally, so it's easy. They can do it from their phone or the web app and get help. That is a takeaway to me that is powerful, because it just in some ways democratizes the opportunity for getting help at a time when these folks need help the most. And the second is really one of learning for me that we all know this, but this bias towards action and doing the right thing, if you have the ability to make a difference, is itself powerful, because it's not just you and it's a coalition, it's the others that will see that and join in with their resources, and it's that collective energy and that grouping of capability that can enable us to solve the hardest problems that we face. And so that part of the journey has been an incredible learning experience for us at Merit. That's a really big takeaway, because we face a lot of hard problems as society, and sometimes we feel that, well, it's somebody else. But if you have the capability, and in our case, we happen to be experts at cloud apps for supply chain. That's our contribution. And when called, we felt we had to step in because we could deliver what was needed. We couldn't deliver all of it, though. And so partners like REI that could come in with this incredible values and sort of corporate value as a co-op of caring about communities coming in at the time when we need them. Partners like Kaiser Permanente, who have a tremendous amount of experience, insight into sort of how this vision could happen. Partners like AHA, who have these incredible connections to all the hospitals and sort of sit as a clearinghouse of knowledge and information. And of course, Microsoft and Kearney. So that is the takeaway for me, is that it's the power of a coalition, but the bias towards action of doing the right thing when you have the ability to make a difference, it can be very powerful.
Well said, Bill. And so one last question for the both of you. Seeing that we're entering into colder months, also the flu season, where there's a potential for increase in cases of COVID, what are some of the future challenges that both of you anticipate related to PPE? And what are some of the things that we can do to continue to help? And Bill, we'll start with you, and then we'll follow up with Mark.
So we're going into a very challenging time this winter with increased infection levels. What I think will be challenging is not the aggregate shortage of protective equipment, but specific areas of supply and demand that are just getting overrun. Right now, nitrile gloves are just in completely a mismatch with demand and supply. And that's not an area that can quickly respond for various reasons related to the raw materials that sort of are the shortage. That may be months before we can sort of see a rebalance on that. So part of the challenge, I think, is being aware of those supply side shortages and those demand side needs, and being able to react to that proactively wherever we can. So I think that's a significant challenge, and I think the sort of the need to get funding appropriately applied to the need when it happens is another area that we're working. We want to make it fast and simple for funding donors for us to intake that funding and to move through that process and make sure we can deliver to the need as quickly as possible. So those are two things I think we're looking very hard at as we go through the next sort of 5 or 6 months here, and try to help these healthcare workers with our platform.
So I can jump in and say that we've learned a lot already from the first 6, 7, 8 months of the pandemic, and we may, with this coming winter, just be required to lean back into that recent learning. And I'm confident that as REI Co-op, we'll do that. And if other companies are in a position to do the same in the coming months, I'd strongly urge them to do so. The economy is still tough. Some sectors have come back better than others. Some sectors continue to struggle very, very badly. So the recovery is uneven at best. But if you've got the capability, I'd harken back to something Bill just mentioned about, looking at your resources and thinking how you lean in and give it your all, notwithstanding the uncertainty of the times. For REI, we're in retail, and retail is still a dicey situation in a time of COVID. Our costs are way up. At the same time, people are recreating a lot, and so the system is moving along. But notwithstanding the uncertainty for us, we are looking at how we can continue to be philanthropic in the coming months and year, and how we can continue to help the country through the crisis. And then, in that spirit of being a good corporate citizen or collaborative, no strings attached. I'm accustomed in the philanthropic world to donors who, want to be sure that, their dollars are being spent well, and, the results are going to generate X, Y, or Z, and that can breed a degree of caution in the process, if you will. But, we're in this unprecedented crisis. And one of the things that I've particularly loved about this multi-party partnership is, to a person, to an organization, I've just been introduced to and gotten to know the highest quality people, whether it's at AHA, whether it's at Kearney, whether it's Bill and his folks at Merit. And in that circumstance with, high quality people just trying to do right by a difficult circumstance, give generously, and have faith that those high quality people are doing the right thing.
Well, thank you, Mark and Bill, for your time today and for sharing your experiences in this collaboration and really working together to help support not only hospitals, but other organizations in addressing PPE needs.
Yes, thanks for having me.
Thanks, AJ. Great to be here.
So again, thank you for your time today. And Tom, I'll turn it over to you.
And the close in 3, 2, 1. To learn more about the work being done to support hospitals in addressing their PPE needs, please visit 100millionmasks.org and healthequip.com.